Hi guys, it is Dr. Dawne, Chicago's own board certified OBGYN. I am here today chatting with you because you know my mission is to empower women of all ages with pertinent medical information and proactive reproductive health knowledge that will optimize your physical and mental health, thereby strengthening your self-esteem and motivating you to achieve more for yourself, because I really believe once you know more, you'll do better. So how you guys doing tonight? I'm really happy to be here. I am going to start talking with you guys every Thursday at 6 p.m. So every Thursday at 6 p.m. I want you guys to meet me here. Hey, Dr. Manny, thanks for joining. I want you guys to meet me here on Thursdays at 6 p.m. because I'm going to be talking to you guys every week on a variety of topics. Because I'm going to do it weekly, I want you guys to either put it in the comments or message me with comments or topics that you're interested in me talking about. I get a lot of conversations I have with my girlfriends, and that's really where I get my Facebook Live ideas, and that's actually where I got the idea today. But I want to open it up to the greater audience. So just hit me up. You can message me and leave me a comment and let me know what it is you want to hear about, because I'll be happy to talk to you about it. So tonight, I just wanted to talk about something really basic, and that's preventative care in your 40s. I think as the medical profession and as physicians in general, important it is for us to stress preventative care. And I think that becomes even more important once you get into your 40s. Why do I think the 40s are something where you need to just press pause and start paying attention to your body and your health? It's because I think as you're younger, you just have your metabolism that works in your favor. You can eat what you want. You bounce back from accidents. If you're playing basketball and you get a strain in your back or in your ankle, you bounce back really quick because you're 20 years old. So your body is nice and pliable and you don't really have that many problems. But as you get into your 40s, you don't bounce back as much. Your metabolism isn't as quick. And a lot of the bad habits that you have picked up in your 20s start to impact you in your 40s. So I wanted to just talk to you, the audience at large, about how important it is to really start focusing on your preventative care. The first thing I think everyone should do is find a primary care physician. Find someone that you have a relationship with, that you go in to see regularly. If adult people can get a family physician, internal medicine doctor. You can, for women, a lot of women use their OBGYN doctor as their primary care doctor. But it's important to get in and establish care with a doctor that knows your history, knows what is going on with you, for a lot of different reasons. A lot of times it takes more than one visit for us to know what we need to do for you in terms of preventative care. You might come in, we get your chart, we'll look at it real quick, but we have to have time to really talk to you, and talking to you can also give us an idea what we need to focus on. So if you have a doctor that you see on a regular basis, that helps us to maintain your baseline physical health. Hey, Dr. Candace. Hey, Candace, thanks for coming in and joining me. So find yourself a primary doctor. And a perfect example of that is we're in flu season, and this is one of the worst flu seasons that we've had in a while. And a lot of people are coming down with the illness. Maybe they got the flu shot, maybe they didn't. If you have a primary doctor, that doctor is going to talk to you about getting the flu shot. And maybe you'll listen to this person a little bit quicker if you have a relationship with them. And the flip side is, if you call your primary care doctor, they may be able to get you in to see you a lot quicker so that you don't let it get worse and then end up in the ER not being able to breathe because you got the flu really bad. And then a lot of times they have access to medicines like the Tamiflu, or they can tell you some other things you can take so that you don't have to take off from work. You can start kind of rehabilitating at home. So first thing I want to say is find yourself a primary care doctor that you regularly see. And it may take a while. You know, if you have a insurance plan and you go on your plan and you pick somebody who's in your neighborhood and maybe you meet them and you don't really hit it off right away, A, give it time, or B, if you really are not hitting it off, just find another one. Sometimes it takes a while for you to really find somebody that you mesh with, but it's going to be worth it in the end if you find someone and you go to them and you build a relationship. So that's the main thing. Find a primary care doctor. Number two, the other reason that it's important to have a regular physician is because, like I said, in the 40s is when you start seeing the results of habits that we've picked up. Some of these things that we pick up, we don't even think about. So, like, maybe you're not exercising on a regular basis. Maybe you picked up smoking as a younger person, and maybe at that point you were doing it once every couple of weeks or just when you go out and party, but now you're doing it almost every day. Those things impact you greatly when you become older. There are also some diseases that you don't necessarily get a symptom from it until it's too late. So things like high blood pressure, they're very common in certain communities, especially people of color, but you may not necessarily have a symptom from it, and when you do get the symptoms, it's often really worse off, and we have to really work hard at putting you on medication and doing things to help you with that. Whereas if we can work with you a little bit at a time before it gets bad, we can give you some things to do, lifestyle changes that won't require you to take medication. The other thing is in your 40s, when you do start seeing those medical conditions that kind of are more prevalent, so things like high blood pressure, things like high cholesterol, things like diabetes, type 2 diabetes, all those things tend to rear their head in your 40s, and that's when we start having to really pay attention to, okay, this is somebody who, if they're not able to make lifestyle changes, we have to put them on medications. Medication is hard to remember, hard to take, you might have side effects, so the best thing is to set up with your primary care doctor so that we can talk to you about lifestyle changes that you can make so that you don't have those illnesses. So one of the things that women come in to talk to me about in their 40s is that they feel like their metabolism has slowed down. And that can happen. It's a little more frequent in your 40s. But again, if you have a primary doc that you're seeing on a regular basis, we can start talking to you about that. We can start talking to you about your diet, about certain things that you need to change, that you need to focus on. Maybe you need to increase your vitamin intake. You might not be someone that took vitamins, but you may want to focus on taking vitamins, making sure you're getting your calcium, making sure you're getting vitamin C and vitamin B6. All those things help with your metabolism. We can also look into specific medical problems that could cause your metabolism to slow down. Number one is your thyroid. Again, thyroid could be something that the symptoms are so subtle that you may not pay attention to it, but if we see you on a regular basis, we can notice that, hey, there's a change. Maybe you're getting a goiter, or maybe we see something physical that makes us think we need to check your thyroid. Maybe you're just having the complaint of having your metabolism slow down. So your doctor can look into it and do the tests that we need to do to make sure you're doing okay. So one of the things we'll see is weight and metabolism. So a lot of times what I will encourage my patients to do is to get on a regular exercise plan. Exercise is not only important for those of us that are trying to maintain a weight or lose weight. It's a really good stress relief. A lot of times if you get in your 40s, you have more responsibilities, you have a greater, role at work, you have a family that you have to take care of, you have to take care of the household. So oftentimes all of that can create pressure that gets you really stressed out. Exercise is a perfect way for you to alleviate that stress. The key is to find things that you really like to do, find an environment that you feel comfortable in. Sometimes that's just a running group, or sometimes that's a smaller gym, sometimes that's a LA Fitness. Sometimes you may do things like line dancing or stepping, or just things that get you moving, get your heart rate going. The key is to get something that you can do on a regular basis, at least 3 to 4 times a week, and something that's going to get your heart rate going. And also when we talk about exercise, we want to talk about weight training, especially for women. One of the things that we see as you get older is that you lose the density of your bones. And you can develop osteopenia or osteoporosis. Well, weight-bearing exercise is really important and really helpful for making sure that you maintain strong bones And the muscle mass is actually going to help your metabolism stay quick. As you have more muscle mass, you're going to burn calories a lot quicker, and your energy level is going to be a little bit better. So that's another reason why you want to exercise, not necessarily only focusing on your cardiovascular, but also focusing on weight training, and having someone that can show you the proper form when you do that. So some of the things we see, like I said, metabolism, exercise can help you with that. One of the things that ladies often come in to see me about, and that's because I'm an OBGYN, is because they have cycle changes, menstrual cycle changes. Some women have never been regular, and all of a sudden they get regular. Most of the times they're coming in just because it's becoming heavier or it's becoming a problem for them. So a lot of times I'll have women come in and we have to do an evaluation to see what we can do to help regulate their cycle as we get older. One of the things you want to pay attention to is if you have irregular bleeding and you tend to be a little heavier, we need to look into that to make sure you're not developing precancerous cells or cancerous cells in your uterus. That tends to be a little more common for ladies that have been overweight for a long period of time. But again, we're talking about people in the 40s. So if you've been overweight in your 20s and you continue to do that in your 40s, you can be at a higher risk for heavy bleeding that is the result of precancerous cells, or in the worst case scenario, cancer cells. So that's another reason why you want to have a regular doctor that can look into that. Hey, Helena, thanks for joining. A regular doctor that can look into that and keep abreast on that. So, just kind of a summary of what briefly I was talking to you about. This talk is really about preventative care in your 40s. Why is it important to establish some type of a medical doctor that you see? If you are a guy, of course, you're not going to see an OBGYN, but you guys really need to get in with either family physician or internal medicine doctor, because men have a higher incidence of cardiovascular problems, which can be a result of high blood pressure. If you have high blood pressure, it can affect your heart, it can affect your brain, which can be a stroke, it can affect your kidneys. And again, high blood pressure is not something that's always symptomatic, so you need to have a doctor that can do some regular testing on you to make sure that you're not going into a risky category. Especially for men, you also in your 40s want to look into your prostate. A lot of guys don't want to get that test that you know you need to get done, the prostate test. But I know for a fact, because I have a lot of family members that found changes in the urine stream, had that prostate check, and actually had prostate cancer. So it's, again, a little more prevalent, and not just more prevalent, but it can be a lot more aggressive in people of color as opposed to other populations. So I know it's hard for you guys to even bear the thought, but it's something that you need to do because it's your prostate, it's a sensitive area. You want to take, hey, Dr. T.C. Bush, Tamika, thank you for joining. You want to get in and make sure you get that checked out before it becomes a problem. So today's message is preventative care. Establish yourself with a physician. Make sure you're getting in for those preventative measures. And also, don't let me forget, for women, we know that we need to be getting our regular pap smears, right? And we also need to start getting our mammograms. And depending on the density of your breast, you might even have to get a MRI or something to that nature. You may have to get a breast ultrasound, but at the very least, you need to start with the mammogram so that you take care of your breast. Because, again, you want to catch things before they become a problem, before they spread to other areas. So for ladies, make sure you're getting in and getting those pap smears. Make sure you're getting your mammograms on a regular basis. And make sure you're just basically getting the overall health monitoring. Then we check your weight, we check your blood pressure, and it's a time for you all to check in with us and tell us, okay, how are you doing? What are your concerns? What's happening? And if you initially find a physician and you don't really hit it off, do your due diligence and make sure you see another doctor or see that doctor one more time and really write out what your concerns are so you make sure that they are addressed. And a lot of times, if you're able to write it out and say, hey, doc, this is what's concerning me, we can then focus on that and make sure we're taking care of you appropriately. But do your due diligence and find yourself a doctor that you feel comfortable with and make it your business to see that doctor at least once a year. Most times twice a year is what you're going to need. So that is it for today. Like I said, I'm going to be doing these talks every Thursday at 6 p.m. So check in with me and drop me a message if you have a topic you really want me to talk about. I focus on women's health, but if there's another topic outside of women's health for the guys and you're interested in, let me know. I can research it and talk to you guys too. So if you're enjoying this talk, be sure to like my Facebook page. I have a Facebook fan page, Dr. Dawne OBGYN, so be sure to like that page. You can follow me on Facebook, Twitter, Instagram, and YouTube. I have modalities in all those areas. And I love to hear from you guys, so if you have questions or you have a different topic you want me to address, just let me know. All right, guys, have a great evening, and I will see you next Thursday. Thank you.